Sjogren syndrome. Sjogren syndrome is an idiopathic autoimmune disorder secondary to antibodies predominantly against lacrimal and salivary glands. 90% of those affected are women. Sjogren syndrome is associated with rheumatoid arthritis, SLE, primary biliary cirrhosis, polymyositis, Hashimoto thyroiditis. Primary Sjogren syndrome is an autoimmune disorder characterized by lymphocytic infiltrates and destruction of the salivary and lacrimal glands and systemic production of autoantibodies to the ribonucleoprotein particles SSA, Rho and SSB, Le. Sign and symptoms. Sjogren presents with dryness of the mouth and eyes. Ocular abnormalities give the feeling of sand in the eyes, as well as burning and itching. This is called keratoconjunctivitis sicca. Dryness of the mouth gives a patient presenting with the need to constantly drink water and difficulty swallowing, especially dry foods. Loss of saliva leads to rampant dental caries and loss of teeth. The main function of saliva is to neutralize acid on teeth and physically wash food off teeth. Loss of vaginal secretions leads to dyspareunia. Less common manifestations are vasculitis, lung disease, pancreatitis, renal tubular acidosis, 20%. Symptoms. Tip. When asked what is the most dangerous complication of Sjogren, answer lymphoma. Diagnostic tests. The best initial test is called a Schirmer test, in which a piece of filter paper is placed against the eye and then observed for the amount of tears produced by the amount of wetness on the filter paper. The most accurate test is a lip or parotid gland biopsy. These reveal lymphoid infiltration in the salivary glands. Best initial test on blood, SSA and SSB. These are also called Rho and Le, and are each present in about 65% of patients. SLE is associated with SSA and SSB in 10% to 20% of cases. Rose Bengal stain shows abnormal corneal epithelium. Other abnormalities that are present, but are nonspecific: ANA, RF, anemia, leukopenia, and eosinophilia. Treatment. The best initial therapy is to water the mouth. Use frequent sips of water, sugar-free gum, and fluoride treatments. Use artificial tears to avoid corneal ulcers. Beware lymphoma in Sjogren syndrome. Pilocarpine and savimline increase acetylcholine, the main stimulant to the production of saliva. Savimline increases rates of saliva production. There is no cure, but lifespan is not shortened. Evaluate for lymphoma, which occurs in up to 10% of patients.